Welcome everyone to this Masterclass in Innovation, Leadership, and Entrepreneurship, part of our MILES series with the Women's Entrepreneurship Initiative and the Office of Alumni Relations. Today we have I'm so excited about this talk because I think it's so both relevant to the world, and we have amazing speakers here today. Today is a masterclass in healthcare funding during the COVID crisis to look at trends and predictions to see how innovation might come out of this crisis. And I think I was just reminded that in the last financial crisis, companies were formed right after that now make up close to 9% of the NASDAQ. And so I think that this is a really interesting time for innovation. I think you see companies and new technologies come out of these kinds of situations all the time. So we're joined today by some experts in the field, both in healthcare and business and investment, to give us perspectives on how the landscape has changed overnight, what might stick, what might not, and where the innovation might really be. So today's format will be a Q&A between Dean Carmen Sceppa, who is Dean of the Bouvé College of Health Sciences here at Northeastern, and she's joined by Nancy Brown, who is the general partner at Oak HCFT, a big investor in healthcare, and manages about $1.9 billion in those fields. And she's also joined with Ann Corcoran, who's the president of AMC Healthcare Solutions. So without much further ado, I'm just going to say this is an informal setting. I encourage everyone to just throw questions into the chat. I'm going to let Carmen, Nancy, and Ann have a conversation and a dialogue. And as they're talking, if you put questions in the chat towards the end, we will synthesize those questions and maybe call on some people to ask their questions live. So without further ado, I'm going to turn everything over to Carmen. Thank you so much all for being here. And yeah, let's go.
Great. Thank you, Betsy. This is an honor to be here with Nancy and Ann. And before we get started, I would like for Nancy and Ann to introduce themselves and tell us briefly a little bit about yourselves. I will do the same, and then we'll kick it off with the first question. Please, Nancy.
Oh, great. Well, thank you so much for having me. My name is Nancy Brown. I'm a general partner at a venture capital firm that's based in Boston, Greenwich, New York City, and San Francisco. And it's focused on healthcare and fintech, hence the name HCFT. I'm on the healthcare side completely. I'm a proud MBA graduate from Northeastern in '86. To truth be told, someone had to look that up for me, so that I think I try to forget how long ago that was, but it was it put me in very good stead. My whole entire background is healthcare. I started off right out of business school at Northeastern, working for a staff model HMO and studying clinical process. And to make a very long story short, I ended up going from nonprofit, where I was for quite a long time, to starting companies to develop technology to support healthcare, technology that didn't exist back in the day. Making that long story short, worked in 3 early stage companies. 2 of them were sold to a major corporation, and the middle one was Athena Health, which went public. I made a decision 6 years ago to transition to, some people call it the dark side, I would not, but to the side of investing and having the unbelievable opportunity of working with some of the best and brightest entrepreneurs in healthcare, which we'll talk about more later. Thanks for having me.
Thank you, Nancy. Ann?
Hi, everyone. I'm Ann Corcoran. I'm also a Northeastern alum from 1986 in Bouvé College of Health Sciences, and I'm delighted to be here with all of you. I've run my own healthcare consulting firm for the last 25 years, and I basically specialize in advising owners and CEOs of healthcare companies in the technology, services, and data analytics areas. I advise private equity firms on their acquisitions, and I sit on the boards of some of their portfolio companies. My passion really has been throughout my career working with the innovators and helping them create new business opportunities for their products and services. You know, some of the things that I'm working on now are I'm advising the owner of a national telemedicine provider on their growth strategies. It's pretty current. It's crazy right now in that business. I'm also advising the board and CEO of a long-term medical home care provider on their exit strategies. And so that's very active. I'm also advising the CEO and COO of a UK-based mobile healthcare workforce company, and helping them look at entering the US market. So, you know, I have a lot of volunteer commitments as well, more Boston based on the volunteer commitments. I'm the president of the Vincent Board of Managers at Mass General Hospital, very tied into that health system from a volunteer basis. And I also am a board member of Sanseal, a nursing society that really spun out of some of the nursing entrepreneurship and innovation work done here at the university at Northeastern. And I'm currently a steering committee member for the Venture Mentoring Network here at Northeastern, and I mentor startup healthcare companies with HSC. So, you know, you might see me around campus throughout the year, hopefully more in the coming year than this year. I'm delighted to be here.
Thank you, and thank you both. And I just want to briefly introduce myself, Carmen Sceppa, Dean of the Bouvé College of Health Sciences. I'm a clinician, researcher, and educator. I wanted to mention these three things because I truly believe that clinical experience fuels discovery, research, and entrepreneurship. And we are seeing with our great guests today how entrepreneurship and innovation is so key for the work of the healthcare professional. Research accelerates science into practice, advances knowledge, and provides solutions for grand challenges in health. And we are certainly living through one at the present time. And as an educator, we want to make sure that we train health professionals, not only future, but current, so that they stay up to times and they really have the skills that they need to anticipate what the landscape of healthcare is all about. Experiential learning, certainly in the contextualized immersion that happens in real world settings, in the hospitals, in clinics, in communities, in schools and the workplace, are very important to inform discovery as well. So this is important as we think about education as a key of the enterprise, really, about healthcare. So with that said, let me get started with the first question. And this is a question for both Nancy and Ann. We would like to know about the key shifts that you have seen in the landscape of healthcare as a result of the pandemic. And specifically, if you can speak to shifts in funding and or training opportunities, that would be great. So we'll start with Nancy and follow up with Ann.
Great, well, thank you. I think we could probably go 3 or 4 hours just on this question, but we won't. We'll try to summarize it. So it feels like almost everything's changed. I mean, meaning there's been a fundamental shift in prioritization for the very players in the healthcare ecosystem that we work with. So as an investor, a lot of our companies are facing payers. They're providing services to payers, insurance companies, or providers, hospitals, physician offices, and employers. And so as we come into the pandemic and now come back out the other end, we have to be acutely aware of what their top issues are. So I won't get into a thesis on every single one of them, but I'll talk about some things that may be obvious to others, but may not be. So for insurance companies, we have quite a range of activity. And I'd actually have to say that there's a framework for all of them, which get to the priorities of first, do no harm. So make sure that your employees, your students, in the case of Northeastern, your insured population are not put in harm's way. So a tremendous focus on how to get people back to work, what kind of tools to use, and transitioning from just thinking about employees to the patients that they represent in both the hospitals, the physician offices, our chronic care management patients, et cetera. How are we going to deliver care to them in the future? So there's a tremendous focus, as people have seen, on virtualization, which we can talk a little bit about more as we get into some of the other questions. But how are we going to treat patients where they are, keep them safe, and make sure that they continue to get the care that they need? A tremendous shift in focus on operational efficiency. So there is a financial crisis hitting most of the delivery systems, physician offices that are that may never recover or come back, hospitals that have just been spending wildly and appropriately to serve these COVID patients, not knowing how they're going to make up the deficit. And so if you're someone who's out and you're providing technology and services, you better darn well make sure that you have an operational improvement capability right away. And then there's going to be, for all of these players, a tremendous focus, although not much is being talked about right now, about supply chain. So we all probably, and certainly I studied this during my days at Northeastern, talked about sort of just-in-time management, getting supplies to places as they need it, sourcing in the most inexpensive way possible. That brought us to a lot of practices that worked against us during COVID that we're going to have to take a look at again, figure out what we do around sourcing so much of what we have through other countries that can control our supply chain, and figuring out how to get supplies to people when there's huge spikes in services.
Yeah, Nancy. Ann?
Yes, I've seen three major, shifts similar to what Nancy's talking about, but in my practice, I've really seen the, enhanced adoption of technology across many areas, similar to what Nancy said, virtually, with data platforms. 72% of consumers have changed their use of traditional healthcare services in the last 3 months. That's a survey I read recently. That's a major change to the shift in the way healthcare gets delivered in this country. In terms of, healthcare providers and service organizations, it's taken 15 years for some of them to develop these virtual technologies and telemedicine services, and 3 weeks, they said, to adopt based on, the hit of this pandemic to their system. And so, the main key shift is the enhanced adoption of technology, really, I think by 5 years. I think that this pandemic hit us, and we just sped up the adoption of technology throughout the entire healthcare system with providers and consumers at the same time. On the state level, we saw the adoption here in Massachusetts of texting to be able to survey and direct people to care with those types of platforms that get hooked into the public health system. So that, again, the adoption of technology right away. In the UK, they had the same type of adoption. My NHS customers were using these surveys before we used them in the United States to help patients identify their symptoms and direct them to care, to their providers and hospitals and places where they could get tested. So this technology just, it would have taken years for these tools to be used unless, if this pandemic hadn't happened. Another area, a key shift is I've seen, again, Nancy mentioned the innovation, a surge in innovation in health systems. I know at Mass General, for example, their head of innovation has worked to develop new ways to source and identify PPE at the local level and regional level. I know they've done that down in Pennsylvania at UPenn and their health systems. I've worked with both those groups to be able to provide PPE to them over the last 3 months in a project that I worked on with Sanseal. But the surge in innovation, I think, looking at the way we provide products locally. Again, the whole supply chain. We can go on for 3 hours about the disruption to the supply chain, but I think that the innovation that's occurring right here in our local healthcare economy with MIT and the partners, the Tufts, to be able to source and identify new supply for their institutions is incredible. Another major impact I have seen across the country is the changes to medical licensing and the oversight lacks. The lifting of the oversight of licensing. You can now, clinicians can go cross-state in practice. That's going to completely open up a new way for the healthcare workforce to work and to be able to function. So those were 3 major areas that I saw in terms of the shift to the healthcare system.
Yeah. Thank you both. Another question here for Nancy, specifically, are there any specific subsectors within healthcare that we should be focusing on the wake of COVID-19? Where do you see opportunities of this in the near, medium, and long term?
Well, let me continue some of the statements that Ann made, which is suddenly overnight we saw this huge adoption. The statistics are staggering. The adoption of virtual visits. They came in all sorts of forms, and this is something that in my firm we've been investing in virtual first companies for quite a long time. We really believe that people don't love getting out of their chair at work or school or home and driving in traffic and waiting in a waiting room to be seen, when with today's technology, for the most part, the majority of care can be done virtually. And in fact, you can combine a virtual visit, much like we're doing now on a screen, with tools that you can use to check your heart rate and your blood pressure and look in your ear and do quite a few things. These are now very attainable, very cost effective. And we have a great surge in home testing. So most of the tests that you have to do or you felt like you needed to do in the physician office or in a lab, you can do at home and you can mail it right in. And it's an incredible, incredible industry. So for us, we've been looking at this. And in fact, if anyone likes this topic, there is no end of the reports that have been produced in the last 3 or 4 days from the likes of McKinsey and others on what does this trend look like. And the other thing Ann pointed out, which I'll just put another fine point on, is that we had, it used to be required pre-COVID that every physician, every provider, anyone who provided care had to get licensed in the state they were providing care. That got relaxed overnight. The other thing that got relaxed, and I'm doing a broad brush for some laws that are very more complex, is that payment for virtual visits of all sorts got put in place. So it used to be a real question of economics and a real question of going through a lot of hoops to be able to serve a larger population. Those 2 capabilities have been relaxed. There's a real question and there's a movement afoot to make sure they stay relaxed. There's a whole bunch of people, I will not name them, who it would be in their best interest for these things to go back to the way they were. But for access to care and for the advancement of tech, they should not. So the big question in terms of investing in virtualization is, which of the many virtualization paths are going to continue? One of the biggest trends is taking, since we're sitting in Boston, at least some of us, we take our institutions here. So a lot of our doctors that we go to that we're used to physically going to see are now offering virtual visits. And the question is, will they maintain that? Will that go away? Will that just be only until there's a vaccine and that'll go away? I would suggest not. If the reimbursement stays in place and the legislation that got changed stays, they will continue to see patients virtually because it's incredibly efficient. The other big part that we're looking at is chronic care management and things like maternity care. So I have a women's health company called Maven Clinic, which is virtual women's health, is now knee deep in discussions with insurance companies around being able to support a virtual maternity benefit. So going into the doctor when you're perfectly healthy to have basic maternity care, I want to emphasize, doesn't really make sense to people. So we're seeing these fundamental changes, and the question is, there's three types of companies. One is the technology itself that you give to places like Mass General so they can be virtual. There are companies that are virtual first, meaning that your doctor's actually virtual to you most of the time, except for when you need to be seen. And then there's also subspecialties, which we think is a big trend. So one of the biggest areas of virtualization that has happened during this is mental health. So we've always had a mental health supply and demand problem. And now, and then sadly through COVID, we had more demand than we had before. And more of this has been brought online. So this is a very long answer to we're watching all these trends. We'll continue to look at virtual. For me as an investor, I would pick things that are sustainable, where you have a sustained relationship with a provider virtually, not just one where you're going if you have an earache or you want to check on your COVID symptoms, like urgent care, but really a sustained relationship. I think that there's going to be in that a reinvention of care of chronic care management. We cannot take our congestive heart failure patients and our diabetics and folks who have underlying conditions and drag them across town to check and make sure that they're doing okay. Again, those things will really change. And the other thing, and we can shift back to it so I don't take up too much time here, is we're big investors in social determinants of health. These are the gaps in services like housing and food and mental health and transportation. We have seen an enormous expansion of through our company called Unite Us, of the use of a social determinant platform to make sure that people can get access to the basic and fundamental things they need to live because of the correlation to care. And we're seeing, unfortunately, a whole new level of need as a result of COVID.
Thank you, Nancy. Great job trying to put a very loaded question into a short answer. I really appreciate that. But I want to take from the point that you made on sustained relationships and ask Ann, how do you advise, what advice do you give to your clients who are entering the healthcare workforce in the present environment, because they are members of this sustained relationship that is required? And how do we engage them in a way that is, like President Aoun would say at Northeastern University, robot-proof?
Well, I know with some of my existing clients, we're looking at expanding the care model to include, not just physicians, but pharmacists, PT, OT, to be able to provide care more on an outpatient basis because of exactly what Nancy's talking about, the expansion of virtual technology. We, with some of my customers, we're looking at models of virtualizing outpatient care because of the shift to the community and care, and again, the impact of COVID. There have been studies that show that 20% of emergency room visits can be avoided using, virtual urgent care programs with telemedicine and consults, and those types of models are being looked at right now with some of my customers, and we're speaking to payers to discuss these types of models and services and decide, helping them realize that those are efficient and operationally capable now where they wouldn't have been in the past. We're looking at tech-enabled medication administration models. For example, having a nurse in the home when a chemotherapeutic agent may be delivered, or an immunologic, something that would have been delivered in a physician's office or an outpatient clinic, but with the oversight of, say, an oncologist or another physician in a telemedicine format. And so we're discussing and building on our relationships with payers to look at these models and include pharmacists in the discussion and education of patients when they are prescribed new products, and to really have them be part of this team and pay for those types of consultations, whereas in the past it was sort of marginal. These things were, talked about, not implemented across the country. I mean, we're looking at new ways to deliver care, and especially with the easing up of the regulations of licensing and the cross-border availability of physicians to be able, clinicians to be able to provide care. So these care models are really being evolving and changing, and payers are really looking at concrete services that they will pay for that involve a lot more people and technology. So those are the types of things that I'm talking to my customers about. One thing I thought was really cool is with people that have had strokes, to use virtual PT and OT and engage patients with gaming apps for them to perform some of these treatments and therapies that they need. And so these are really, the types of different models of delivering care outside of a clinic. They're all in the outpatient virtual space. So
thank you.
I don't know.
Yeah, no,
I answered your question,
yes.
But these are the types of things I'm engaging with my customers and their payers to get these things paid for. So.
Absolutely, and indeed we are seeing a change in education as well. But I'm very interested in the interprofessional approach that you are talking about, because as we see, for healthcare not to be fragmented, it really requires an interprofessional, interdisciplinary approach. I was also very interested in what Nancy was talking about in terms of social determinants of health, because when we think about the impacts of COVID, not only in terms of investments and economic impact, there is the emotional toll, obviously, that the pandemic has taken, particularly around underserved and underprivileged populations. So these are key elements for us to be thinking about. I can tell you, I'm originally from Guatemala, and that's where I studied medicine as I became a medical doctor. And part of the work that we had to do in medical school was to be in a rural area and be the only physician on site to take care of whatever that came to the area, in a remote area, in a rural area. And the thought about telemedicine that can reach out to remote areas is really very important, because there are a lot of populations within the US and globally that will benefit greatly from this. So thank you for the work that you are doing in these areas. I'm cognizant that we have taken the first 30 minutes of our masterclass, and we have about 80 participants. So I just wanted to make sure that we open it up for questions from the audience. We can always come back to additional questions, but Betsy, would you help us with this part?
Yes, I mean, there's nothing I love to see more during these master classes than a chat blowing up. We seem to have questions from all over, from current students, alumni, faculty, staff. It's great. So it's hard to distill all of these, but there are a couple of people who have asked some questions, and I'm actually going to call on them to ask those live if they're willing. Otherwise, I'll repeat them. But Rupal Patel had a couple of very interesting questions. And so Rupal, if you're there, it'd be so nice to hear from you and hear your questions.
Sure. My first question was around the fact that these new technologies and new methodologies were adopted so quickly. Has that left vulnerabilities in terms of patient privacy and data privacy that we could see as opportunities for things to address? Because health data is probably the most important data that we could have, or financial data. So I think this is probably more at Nancy, or maybe both of you. The second question I had was related to maybe if there are new subspecialties or new roles that we could develop within the university that can address this new shift in home care based or virtual therapy based disciplines. So those are two of my questions.
Well, I'll start. I love both those questions, and it's nice to see you. We always do these with we only see people's names and don't get to see them. Okay, you're going to see a little of my bias around the data issue. So I think I started to put medical information online in the late 80s. And I think there was a headline years ago in the Boston Globe that said, beep if you're on Prozac, which was a way that they entered into the world of saying, do you realize that your medical information is going into a computer? And now people are going to find out everything there is about you. And I would suggest, without doing a sub masterclass here, that most technology is way more secure than paper charts and the rest of it. In this world of virtualization, so for the truth be known, there were some leading providers, none will be named, who liked to virtualize care a long time ago, who recognized they didn't want to drag patients in with foot injuries or heart conditions, and they would do things like use their iPhone to talk to folks. So there was a lot of things going on, and I remember for a personal example where they'd say, just don't put the name of the patient, like I'll know who it is based on who you are, and I wasn't the patient, but just, okay, so the good news is now we fast forward, and there has been a tremendous amount of work done around HIPAA compliant technology that people can use. Even I think, and Ann will tell me if I'm right, I think there's even a Zoom version that there's all these tools that exist now because people saw this coming. The biggest problem is adoption, not the tools needing to be available. And there were a lot of people out there ready to sell to all the doctors and others tools that were compliant and secure, for sure. So that I think is, is there always gaps in people not following rules? There, it may be, but I would say that that you have improved access by a lot, and all of this stuff is audited. You can audit it, you know exactly what happened. There's even video at times now. So in terms of security that you're talking about and better care, I think it'll support that. I'll take the second question too, just and then Ann can go and answer both. So this is a great question, and we got talking about it, about educating who are these new healthcare workers. And I have, I think, as I mentioned, a company called Maven Clinic, which is women's health, Cricket, which is renal care. We have primary care that are virtual, like Firefly here in Boston and others. And they are doing, if not all of their care remotely, 90-something% remotely. And I would suggest that the personality that goes with the ability to do that well it's different. So you have a different skill of one working with the computer systems, integrating information, being able to have clues about the patient when they're not physically in front of you, all those sorts of things. And I think we talked a little bit to Carmen about the challenge and opportunity of educators, of let's just say nurses, for example, or social workers, of the spectrum from being an intensivist nurse, where you're physically with the patient, to never seeing patients, and having to get used to new technology and guiding your patients how to put the otoscope, to their ear, or how to deal with their internet connection. So I think it's an exciting time, and I think if we match people correctly, they'll find their clinical path.
I think there's a real opportunity there, which is what is exciting to me, because you can define new subspecialties or even the same jobs being done in different ways. And we could be at the forefront of doing that. So that's kind of cool.
I agree.
I just want to add a little bit to what Nancy said. I completely agree with her in terms of the data privacy and security. I don't have anything really to add in terms of, new opportunities there, except to say that consumers now want to be able to control their own health information and on their phones, and to have that be portable. And that may be, pose some type of opportunity for companies to deal with the data privacy there. But again, I don't think there's a lot new in that area. In terms of, new roles at the university and the way to maybe educate clinicians coming out of, say, Northeastern, Bouvé. I know just by being part of the entrepreneurial and innovative ecosystem at Northeastern, that there are a lot of things that Northeastern's done to create collaboration among the different healthcare professionals, with student-led innovation groups, the Vital Group. What I would suggest in terms of the models at the university would to include design thinking and innovation thinking in really an undergraduate curriculum, so people can really identify ideation, design thinking, so these are just part of the way they think, because the healthcare systems and the community settings and the urgent care settings and all the places where healthcare is going to be delivered across the interdisciplinary team, they're all going to need to adapt to the use of new technologies, the way models shift and change to be more efficient. And so, I think that really giving people also basic business skills early in their career, as well as the very strong science and clinical foundations that have traditionally been taught, is going to help. I think, I look at some of the CNO, the nurse chief officers at healthcare systems, and a lot of them, have had they get their MBAs and things like that. But I believe, by having basic fundamentals of business strategy, operations, and finance kind of interwoven into a curriculum for any healthcare practitioner, they're going to be better served to go out into the healthcare delivery system in any capacity and think a little bit broader. In addition to the technology skills that Nancy mentioned, obviously, they're going to have a broader view and lens there in terms of how technology is applied in the healthcare system. I think one of the things that Northeastern has done well is I was a judge in a pharmacy class a few years back, where the pharmacy students were able to develop businesses that they thought up of, and they pitched them to myself and a few other people on campus. And I think those types of engaged activities with an interdisciplinary team is really something that could be incorporated into a curriculum for all the different health science professionals that you're educating.
That's great. Thank you, Rupal, so much for those questions. And I'm now going to turn the floor to one of our students who's part of the Vital student group, which is the Bouvé Health Sciences team. Alyssa, are you there? And can you ask your questions?
Hi, thank you so much for having me at this talk. I'm really interested to hear all about this, and it's really relevant to our undergraduate healthcare club. So you've been discussing how the use of telemedicine will hopefully continue, but it's pretty reliant on policies regarding reimbursement, both at the government and insurance company level. How have insurance companies shifted to better accommodate telehealth services? And what's the key to making sure these policies actually stay in place in the long term to accommodate these services?
Well, go ahead, Ann. It looks like you're ready to.
Yeah, I mean, in terms of the shift with reimbursement, CMS announced within the last week that they want to continue reimbursing telehealth, and that's on the agenda, for the future. So that would be fantastic, because Medicare and Medicaid makes up, almost half, 45% of our healthcare delivery at this point. And so the paying, the ability for telehealth to continue to be reimbursed at the same rate as an in-person visit is really going to enable a lot of these systems to continue. I do think at the hospital level that some of the telehealth visits will level off. And that's why I think the shift, as Nancy was saying, and I was saying, to the outpatient virtual health adoption of those great companies that you're investing in, Nancy. I love Firefly. It's one of my favorites. I really, a lot of the ones you named, I've been watching for years. I think they're fantastic. But I think that the adoption of these types of virtual technologies is really going to be embraced at the payer level. I'm seeing that now in the workers' compensation payer level with self-funded employers and workers' comp carriers. They're paying right up front for virtual care visits. They're paying for device and equipment manufacturers to ship directly to injured workers at their home. They're really opening up this whole virtual care model and system of reimbursement. And so I'm seeing that being embraced right now.
Yeah, it's a great question. I think Ann's spot on with those comments. You know, the other thing, and this may seem kind of basic, but it's really important, is that the insurance companies, besides reimbursing which they're going to do, and understand that they're really about the overall expenses for the patient. So they're responsible. So they're really interested in going to where the patients are, or being able to engage a patient in their health and getting them better. And so our companies are all based on sort of new approaches to this, and they all exist because they have insurance contracts that support that. So getting, you know, the focus that's being put on kidney care right now, and people have been talking about nursing homes, but people who are going in and getting dialysis every day physically is an absolute, it's a very, very scary place to be. We have a company that's focused on how to keep people from dialysis for as long as possible, and then how to glide them into home care, home dialysis, which is not simple. It's there's a lot of equipment, and it's lonely, and there's all these aspects to doing it. But I can tell you that the insurance companies are really interested in trying to get a better, higher quality, lower cost, better experience for patients. There's no doubt about it, but it's been elusive, because it's hard to affect change. You know, the other thing I'll say is that, and I think I told the story when we were preparing for this, is I'm personally a patient at Mass General. I would say a very sophisticated hospital clinically, more traditional, I would say, in how they approach patient interactions, meaning most of them are physical. And I got a proactive call from my cardiologist, who I see only occasionally, thank goodness. And they said my visits will be virtual, and taught me about this thing called a portal, which of course I know because I'm in the business, but they're like, there's this thing and you can leave questions and we'll interact. And I only bring up that story because they're creating a sustained relationship now with me virtually. They're now got it through their minds that they need to leave those slots in the office for their very, very sick cardiac patients. They need to leave the ones who are in maintenance home and just stay connected to them and give them a way in which to interact. That was really hopeful to me, that somebody as, I want to be careful, but who are sort of focused on the way they've always done things, is really looking at being as innovative as possible. And the last thing I'll say is that the payers are trying to, I don't know how many people on this have an insurance company who's introduced to them an app. I'm a member of Anthem. And there's an app, and the app's name is Sydney, and Sydney does some things. Like, she does some things, she's a little helpful. I'd like her to be more helpful. So one of the things that they're all trying to do is get up to the level that where we're using apps for other things in our lives to use it for healthcare. So now, going from just being able to look up my insurance claim or my eligibility to being able to actually get an appointment, go through a symptom finder, connect to my doctor. All of that is something that a lot of people are trying to do. They call it a digital doorway, a digital porch, digital things. And so there's a big focus from lots of people of how to get more of us to be self-service and be able to guide ourselves through care, or to care.
Nancy, I'm so happy you brought all that up, and it kind of segues into the next question that I think we're going to get from the audience on innovation. I'm going to hand it over to Sean Junker, who is a newly minted alum out of Bouvé from Texas. I don't know, Sean, are you there? And can you ask your questions?
Hi, Betsy. Yes, I'm here. Good afternoon, everyone. Thank you so much for taking the time. This has been so interesting. And I just graduated from Bouvé, and so I guess I'm asking on behalf of, all the recent graduates, who are the companies, or what are the companies that you guys think that are leading the way in terms of this next phase of innovation?
I'll start. I think you have to look at the big three you know, you have to look at Apple, Amazon, and Google in terms of technology and driving innovation in the healthcare sector. Microsoft as well with their Teams-based application. I was just involved in a hackathon for healthcare that was a national and global event 2 weeks ago, and Microsoft Teams was used for everyone to participate. They like to you know, tout themselves as really being integrated into healthcare service organizations for groups to be able to participate, especially right now during COVID. For example, physicians and departments and all the people that work in departments and hospitals can get on Microsoft Teams and communicate and have meetings from their office or from their home, and they can, you know, function that way. So I think Amazon has the ability to provide services in the supply chain in hospitals. They've already developed a service that I know a lot of hospital networks in the Midwest are using for supply chain management, and using the same experience you would get as a consumer. If you're in this, you know, procurement in a hospital system, you click the button and you swipe and you pay for your hospital supplies, and Amazon will deliver them. I mean, these are transformative ways that technology companies are getting into healthcare. Apple, you know, again, with all the interactive applications that they're using that Nancy described, you know, again, I would say look at those organizations. And then there are a lot of small health plans and smaller groups that, you know, are in the forefront leading the way consumers access. Again, Nancy could speak to that because she invests in these companies, but I watch them and try to plug them into the networks I build for self-funded employer groups that pay for national health care for their employees. But these are great opportunities for, you know, companies to really leverage what they're doing with you know, an app on your phone where you can access a doctor and get virtual care, and it'll direct you to wherever you want to go. And that's your first interaction. You know, Firefly Health, Orchid Medical Care. There are a lot of different organizations that provide healthcare to consumers now via an app.
And I'll just add, of course, I love the question because it's a layup question. It's like, could you describe your children and why you love them? Yes, I could do that. Yeah. I'm happy to do that. And we have about 22 healthcare investments, and I'm on 6 or 7 of the boards. And you know, what I would say, just to anyone, pre-COVID, post-COVID, to people who are looking for opportunities, if you're looking to work in healthcare, is to one, figure out what it is that, you know, makes you happy, that speaks to you, that's important. You know, as I went across my portfolio, I've got virtual primary care, kidney care, I have opioid, I have a company that's focused on fundamentally changing the fact that 5% of people who go through treatment or only 5% are successful. So really trying to figure out how to holistically go from identification of patients who are addicted all the way through to matching to treatment, all the way through to post-treatment follow-up. I mean, so one, pick your topic. Like, don't think because you're a new grad that you know, don't have that option. Pick the topic that you would just charge the hill every day for. And then our companies, although we use products that come from and we collaborate with Microsoft and Apple and Amazon, who has really got a really fascinating role in all this. But we like to go to undeniable problems, pre-COVID, post-COVID, things that have been broken in healthcare for a long time. We started off with a company that was focused on end-of-life care, which is just one of these win-win-win situations for everybody around spend and quality and satisfaction, called Aspire, which is owned by Anthem now. And this is how I would advise anyone to look for a company, is we take out the whole problem. So I am not interested. It must have been all my good education at Northeastern, which is I'm a big clinical process person. And so I'm not going to, some people will come to me and say, do you want to invest in an app? I'm like, I don't care about an app. An app is tech that has to be applied to a point of view, a process point of view. So basically there are people all over the United States who know if you apply a certain process to a population, kidney patients, women's health, whatever, and you do it consistently and you tech enable it so that it can be efficient, that you're going to get a phenomenal outcome. What we do for a living is take those folks who've scaled across, 1,000 patients and teach them to scale across 100,000, 1 million patients. So go find an organization that has a very contemporary view of a problem that you care about, and is using tech enablement, because it's never been better, to solve that problem and to scale. Feel free to take a look at the ones we picked at Oak. They're all similar to that. And we actually deliver care through most of our companies. We are the care delivery mechanism. Anyway, I have the best job on the planet. Couldn't be better. So I'm very prejudiced towards our investments. Thank you.
That was amazing. Thank you both so much. And we have so many questions coming in on the chat now. And so I wish that this was like much longer. So we probably only have time for 1 or 2 more questions. I'm going to actually call on an alum who's just launched her own clinical research company, Mindy Ditch. She had something in the chat. I don't know, Mindy, are you there? And do you want to ask your question?
Yeah, absolutely. I'm happy to. So first of all, again, thank you so much for your time today. This has been really insightful. Again, Betsy mentioned that I'm coming from a clinical research perspective. I'm consulting in that field now. So we keep talking about innovation and how much is happening now during COVID, or even as a result of COVID. I personally get daily communications from regulators, specifically the FDA, on all of the guidance that they're putting out to help and improve and get this innovation out there more quickly to assist with the pandemic. What are your thoughts on that guidance that we're receiving from regulators? Is it helpful? Is it hurtful? Is it actually making things go faster? And then what do you see in the long run in a post-COVID world? Do you feel like the regulators are going to pull back on some of that, or will it be, moving forward in that mechanism?
I know when I was building this PPE supply chain to just fill in the gap for some of our, hospitals that needed face masks along the East Coast, the lifting of the regulation for even, let's use face masks, for example, flooded the market, which was great. So that really helped solve the problem, because people were able to get masks, but were they the right type of thing? So I think that's going to play out long term. It's the same thing with the testing equipment for COVID. In terms of the acceleration of drugs and the vaccine based science right now that's going on, I think that's going to prove out to be a path to a quicker vaccine, right? So they're doing the right thing, the regulators there. But in terms of some of the standards that the CDC and FDA have put in place to protect patients and consumers in this country with pharmaceuticals and equipment, they're there for a reason. And by lifting that to flood the market with things, I don't know. I really have a real hard time with that. I hope they go back. I know right now FDA is looking at all the COVID tests for antibody testing, and I think there are only 10 manufacturers right now of the testing that's gone through the rigor of the FDA certification, and the other 200 or 300 companies out there don't have the rigor. So how valuable is that antibody testing that now everybody wants? So I don't, I feel like we need those strict regulations to be able to protect people and have good science and practice based around using the N95 that actually does leave the particles out of COVID outside of the body and doesn't enter it, with a fake KN95 mask in those situations. So that's been my experience with the easing of regulations. I'm mixed on it.
This is not my area of expertise, so I am not, I'm watching as a consumer, I guess, more than anything. And I agree with Ann's comments. Boy, it's such a, when I saw the entire stock market move as a result of Moderna, who's a phenomenal company's 8-person trial being successful, you get into the mindset of, and I'm not being critical of them at all. I mean, I think it's amazing, but you get into the mindset of just how much we all want to believe, to be things to be true. And I don't know that the pendulum has to swing back to the middle, because if we give people a false sense of, I mean, this is an obvious statement, if people get immunized and feel good that they're in good shape as a result, and then we learn something different, it's going to set us back. So I am particularly glad that's not my job, is to figure that out. But I know some of the people, I'm sure other people know them, they're smart and they'll get through it, and hopefully they won't succumb to the pressure if they don't feel comfortable with the science.
Thank you so much. So I don't know where the time went. We're almost at the top of the hour, and I realize that I've kind of taken the format from Carmen. And so I don't know, Carmen, if you want to say any last words before we wrap up and thank everyone for their participation. And I'm sorry, kind of time got away from us.
It really went very fast. It's hard to believe, but I want to certainly thank Nancy and Ann for their wisdom and for all the work and dedication that you have put towards this field. It's really interesting that the understanding of clinical processes in a way that it is conducive to the scalability and the quality of care that is necessary when taking into account the provider, the patient or client, the provider, the payer, and the policies is really something that needs to happen in harmony, and how the elements of research, innovation, and education really weave through this fabric is key. And I have learned a lot from the educational side, thinking about how we can think about these problems that we see and we educate our students about, to really be at the forefront of how to address them without knowing them necessarily, but having the tools for their understanding. So thank you so much to both of you and to our audience for their time today. I think that in the chat, there may be a few resources that have been included here or may be included. And Betsy, I think there'll be a follow-up as well from you, as if I understand correctly.
There'll be a follow-up thank you email. And I again want to say thank you. I feel like, we've had this paradigm shift in healthcare, and obviously today's discussion just kind of scratched the surface. I feel like it could have another masterclass on each and every topic we had here to unpack all of those. And for our newly minted graduates who are looking for jobs, I hope we've given you some insight on where the opportunities might be in the future and where to focus. For those who are more seasoned, it might have been a good exploratory session for you. And I know our students loved this session. So Nancy, Ann, and Dean Sceppa, thank you so much for today. So I just need to pitch next week's masterclass. At the same time, we're doing the same kind of thing, but looking at the global fintech sector. So Nancy, maybe you want to come back for fintech. We have an alum, Suzanne Hennestad, who's going to join us from her home in Oslo, in Norway, to talk about the global fintech sector and how COVID might be accelerating some changes there. And we will have some people talking about the US perspective as well. So, and of course, Julia McCarthy, who is one of our newly minted graduates who founded Disrupt, which is our student initiative. She'll be leading the Q&A. So thank you all for being here today. We can follow up with some of you individually whose questions we didn't get to. I'm so sorry for that. And I know, Crosby, you were going to stick a link in for the email for Dean Sceppa's office if anyone wants to get in touch with Carmen directly. So thank you all very much for today.